Hi, I'm here to do my part 2 of my docu-series of my adventure with Hodgkin's lymphoma, which I said is cancer. So today I'm gonna do day at chemo, how that goes, the process, what I do, what the nurses do, and things like that. So I'm gonna start off with I did my chemo over 6 months, every 2 weeks. So in total, there was 12 treatments. They break them up into cycles. So two chemos is one cycle. So um, six times two is 12. So that was 12 treatments, and that was 6 months. Every 2 weeks for 12 treatments is 6 months. So that's how that part goes. And it will be every Friday starting at 8 a.m. I get there and they give me these ugly wristbands that I started to absolutely despise because I was wearing them all the time. Oh, let me get one. Every hospital probably has them, but if they don't, I'll show you what one looks like. Hold on. These things. Hated them. They put them on my wrist, and I'd have to wear it the whole time I was there. It was like being chained, like, this is you, this is how you are, wear this and show you what your issue is type. That's just how I felt about it. I just hated them. And they would give me, it would go on a sheet, and they would rip this off the sheet, and then the sheet would have stickers on it that look just like this, and the stickers would go on like my vials of blood and things like that. So after they do all, put the wristband on, give me the sheet, I'd go back and they start off by checking my vitals. I'd get my weight done. I get my blood pressure, oxygen level, and temperature. I get those three things done, and then they'd ask me the dun 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 101 question list, which I absolutely hated because they were like old people questions. You know what I mean? Like, did I have any falls in the last 2 weeks? No. Did I have a bowel movement? Kind of personal. I just hated those questions, and they'd ask me 2 times per visit. They asked me downstairs because my chemo was in the down part of the building, and then my doctor was in the office upstairs. So they asked me pretty much those whole same questions upstairs. So after they asked me all those questions, they start the process of accessing my port, which I showed you right here. Well, it was right here. I had it removed already. They removed it after 2 weeks after my last chemo, and they took it out. So it was here, and you can kind of see right here. This is where they poked me so many times. So I had a lot of issues with my port working, which kind of sucked. So they poked me a lot, so it's kind of scarred right there. So they would feel around. First, they get a feel because I had the same few nurses, but when I first started coming, they had to get used to. They say each port is kind of different because it depends on how your body is and where they place it. Because some people have theirs placed up here, and like me, mine was like way down here. So it all depends on where the surgeon puts your port, and they decide all that. And they feel around on the port on the porta. Let me see. Hold on. Sorry, I totally wasn't prepared, but bear with me. Okay. As you can see right here on the portacath, they have those three little dots. They look for that. They feel around for it. And they won't stick you until they can find it. So they press around and stretch and feel until they feel those three prongs, and then they proceed to stick me. So the needle is like, it's like this white thing. So imagine, well, I turned it sideways so it make more sense. It was like a white piece over here, and it had like two little like wings on it, so they would pull it down and lock it. And then on this side, it was like a really super small needle, and they poke me with that, and that'd be what they poke me with, and they stick it, put it down, and they put like this big block of tape on it. As you can see, it's dark where the tape. I think chemo made my skin weak, so it darkened me up there, so it's like dark all around there compared to over here. So the tape kind of discolored me. So after they do that, they'd take my blood and they would send it for labs. They do a send it for the complete blood count and a special check on my white blood count, because with Hodgkin's lymphoma and the medicine we're given, which is called ABVD, which I'll talk more about in my video about my meds. That makes my white blood count like really low. At one point it was like a .2, which is like super low. So they check that every time, because they won't give you your chemo if it's too low. They'll give you a platelet transplant, which is white blood cells, and they'll give you that to get your count up before they give you your medicine, since if it's too low when you get your chemo and it makes your immune system compromised and very vulnerable, and they don't want you to get sick, because you can have the risk of getting hospitalized, which nobody wants to be hospitalized. So they check that, and then after they send my blood off of labs, they send me upstairs to my doctor, and I go up there and I fill out this yellow sheet of questions, like old people questions about like constipation, last period, hair loss, things like that, which of course I did have, but it just makes you feel aged when I'm 22 and I have to fill out forms like this. Kind of feels weird when you first start, but it kind of becomes a routine after a while. And I fill that out. Then my nurse, I had the same nurse. Her name was Jessica. She would come out and get me, take me back. She would check my weight and the blood pressure, the my oxygen level and things like that. And then she would ask me if I was on new medications, the other part of the 101 question list. And then after that, my doctor would come in and he would check, since my lymph nodes were swollen and my neck and collarbone, esophagus, and spleen. He would feel all around and see if he could feel any swollen lymph nodes, or as my chemo progressed, he would see if the tumors were shrinking, if they were responding well. So he would do that, and then I would check out and get my next appointment. Then I go back downstairs, and by that point, hopefully my labs have returned, because they can't order my chemo until they get my lab results back. Because if your count's too low, they're not gonna need the chemo right away. They're gonna need to order your platelets. So they check on that. So a lot of times when I would come back, the labs usually hadn't come back. So until the labs would come back and they'd order my medicine, they had like built-in TV, so I'd watch TV, I'd eat my breakfast, I'd read magazines, I'd buy magazines, bring them with me. My mom bought me a chemo bag kit, and it had a book in it. I'd rather do chemo than clean out the garage. And I read that, which was kind of hilarious, and was kind of a cute pun on having to go through chemotherapy. So I liked the book. I kind of was glad she bought it for me. So I do that, text, whatever, like just whatever. And I sit there and wait. And I guess about maybe an hour to an hour and a half later, my medicine would be back. It'd be ordered and back. So they'd hook my port up to the infusion machine, which is those IV machines like you see your grandparents on. They hooked me up to one of those, and they get sodium chloride, which is just like fluid, just like liquid fluid to help flush the chemo out, because you don't want to just sit in you and just sit there. So they do that to help keeping you peeing and flushing it. And they would give me my pre-meds for my nausea, which I'll talk about that. They never worked. Just chemo's gonna make you nauseous. Just suck it up and deal. So they would give me those regardless, and then they would start the process of administering my medicines. I had 4. So when I first learned about my chemo, they told me I'm there all day from like 8 to 2:30, 3:30, but the actual administering of the chemo takes between 2.5 hours. I get 2 pushes, which the nurse will sit there and manually push the medicine into my IV, which would be like 15 minutes apiece. And then I get one 30-minute bag in between the pushes, and they'd hang that up and let it drip for 30 minutes. And then my last one would be an hour-long drip, and that would be the worst one because it's just boring. You just sit there and watch it drip for an hour or whatever. Sometimes I took a nap, but a lot of times it's something that you can't quite go to sleep with, depending on who you are. Me, I couldn't sleep during chemo. It just was, unless I was dirt tired from the night before, I would sleep, but otherwise I'd be like totally alert and wide awake the whole time. So that hour bag would be, I know I'm almost finished, hurry, 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 plucking my nerves type feeling. So That's how I felt with that. And then, so the order was a 15 push, a 30 hang, another 15 push, and an hour bag. And then after that, between each chemo, they would flush me out, of course, with the saline solution for about 10 minutes or so, just to get all of that medicine out of the line before they would proceed to give me the next one. And then after all of that, when all that's finished, they give me a final flush for about 15 minutes. And then after that, they'll put heparin in my line, which is supposed to help keep from getting blood clots. But I'll talk more about that on another video, because I wound up getting a DVT, which is a deep vein thrombosis, which is a blood clot, which had to put me on Lovenox, which is injections I had to give myself. Actually, I have one right here. I didn't finish them all. They started to bruise me and hurt me, but I had to do these every day. Poke them in my stomach, which one of the worst parts of chemo that I had. I don't know if it was worse than the actual chemo or what, because once you bruise your whole stomach up and you don't have anywhere else to puncture yourself but on a bruise, that is a big horde. It's terrible. So they would put the heparin in anyway to try to help, and after that they take out the IV out of the port, and they bandage it up and send me on my way. Well, they checked my exit vitals to make sure I didn't have a fever, because I did have a fever one time and didn't get to leave on time till like 5:30, and everybody literally was gone but the nurses and technicians. So I've had that issue. So they do check your exit vitals, your temperature, your oxygen, and your blood pressure, and that kind of thing, and then they send me on my merry way. So usually by that time I haven't really had a good meal, and I know that that's Friday I'm getting my chemo, so by Sunday my mouth is going to be sour mouth and sore, so I won't be able to eat. So I'll go out with my friends or my mom or something to get a really great meal, because I know it's getting ready to get cut off. So that would be my day of chemo. Then I'd go home and rest, of course. But yeah, that was a day in the life of chemo. So next video I will talk about my medicines and the side effects that I experienced from them. So I'll give you a sneak peek of one of them. It's growing back now. It's beautiful. I had really bad hair, but now it's like baby hair. It's like Indian people hair. It's beautiful. I love it. But I put this on just for comfort, like when I'm at work or in class. It just makes me feel like normal, you know what I mean? Like everybody else has hair, I want to have hair too. Not vain way, but just a comfort blanket type feeling. So yeah, I will talk next time about my medicines and the side effects that I experience, and I will see you guys tomorrow.